further understand the testing procedure, we paid a visit to Dr. Armin Schwarzbach in Augsburg, just outside Munich in Germany.
Armin Labs is highly specialized in tick-borne diseases, testings, and also advice when the results have finished. Tick-borne diseases are very common in the world. We know that ticks are full of pathogens of different bacteria. And my laboratory can test blood samples from infected patients for different bacteria. We name them Borrelia burgdorferi, it's the main bacteria in the ticks, and then we have also other so-called co-infections. Co-infections are Bartonella, Ehrlichia, Anaplasma, Babesia, Rickettsia. And my laboratory is doing testings from blood samples from all patients all over the world. So we find out if there are immune answers against different bacteria or not in the blood of patients. We have different strains against Borrelia burgdorferi. We know actually it's over 8 different strains which can make patients sick. The 3 very common strains in the world, in Europe especially, are Borrelia burgdorferi sensu stricto and Borrelia burgdorferi garinii and Borrelia burgdorferi afzelii. In USA it's a little different. We have more Borrelia burgdorferi sensu stricto, but all over the world we can find a lot of other different subspecies, we name that, and one of the most common subspecies is Borrelia burgdorferi garinii, which makes neurological problems and symptoms. We know that Borrelia burgdorferi is in up to 50% of infected ticks. So patients or people got bitten by the tick, and the tick, if the tick is full of this bacteria, then it can be transmitted into the body of people. And then the question is, how strong is your immune system? How strong is your natural immune defense against this, we name it pathogen Borrelia burgdorferi. And if your immune system is strong enough, you can defeat it on a natural way. If not, you can get symptoms. Symptoms for Lyme disease are at the beginning a bullseye rash. Bullseye rashes are also named erythema migrans. And but it's not in all of the patients. We have just 50% of the patients, of the people who got infected, they really got this bullseye rash or erythema migrans. So 50% you cannot diagnose because they don't have this bullseye rash. And also 20% can get summer flu after tick bite. So it's very important to get to ask a patient, did you get some summer flu after tick bite? Because this is a sign for a current infection with Lyme disease. In this case, we name it stage 1 of the infection. If Borrelia is coming into your body by a tick bite, in a second step it can move around all over your body and can infect each organ system in your body. For example, it can inflame your brain, it can inflame your joints, your muscles, also it can inflame your kidney, your liver, your eyes. It can move everywhere in your body. And this means a local inflammation by a bacteria in your body, which makes symptoms. The question is, which symptoms do you have after tick bite? A lot of patients I've seen, I think meanwhile several hundreds. Personally, I have seen in my office, and I found that a lot of patients, they developed chronic fatigue syndrome immediately. They got very tired after tick bite. They call it also burnout syndrome. They say, doctor, I have a burnout syndrome. Or the patients, they develop neck pain and headache, and especially where the tick bite was on this side where the tick bite was, the patients develop one of the first symptoms, neck pain, headache. And the next can be also migraine joint pain. It can be also another different symptom like arthritis. It can be a different symptom like neurological symptoms, sensitivity problems, burning hand, burning feet, loss of sensitivity, concentration problems, brain fog. So Borrelia can do every symptom in your body you can imagine. the best way to get no tick bite means prevention. And preparation. The better you're prepared, if you have, for example, your clothes are very important, that there is no place where the tick bite can happen with you, for example. Also, if you walk in the middle of the trails, very important, not to lean on trees, not to walk outside the safe situation, not to sit in the grass. So the exposure is very important, and the consciousness. The tick bite doesn't happen immediately. You have also the chance after coming back from outside, from outdoor activities, to inspect yourself. You can inspect your hair, your ears, everywhere. You go under a shower, you look everywhere. You look at your back. Also for children, very important to look everywhere where a tick bite can be, because prevention means everything. The tick is not biting immediately. The tick needs time to bite. It's not done in 2 seconds. So you have time, no panicking. But prevention, prevention, prevention. The probability to get an infection with Borrelia burgdorferi, it's not such a high risk, but the risk is there. And if you estimate 10 tick bites, for example, you get one-time transmission statistically of Borrelia burgdorferi, but that doesn't mean that you get sick by the infection. Nevertheless, we have numbers from USA, and in America we have around 400,000 new infections each year. And in USA, the CDC, they said some years ago, oh, we have just 30,000. That means we have more than 10-fold higher infected people in USA. What does that mean? If you look at 1 year and you do a look at in 10 years, you have in 10 years, you have 10-fold, 400,000, you have maybe 4 million infected patients. And that's a huge number. We have more and more problems with tick bites. Why? Because the outdoor behavior is different of the people. We are forced to go outside to do some sports activities because we are sitting the whole year in our offices. So we need more movements outside, but the risk is outside. And also very important, the climate is changing somehow. We have more and more ticks all over the world. The earth is heating up, so the ticks get active when it's 4 up to 5 centigrades. And also we have Lyme disease cases in Greenland or in Alaska or in northern Norway. So we have more and more ticks everywhere around the world. But also the testing is better now. We find more infected people by better testings, which didn't exist 20 years ago. We have better testings for it. We find more infected people, and the consciousness is better now.